Well, hello everyone, and welcome to today's webinar on Mythbusters, breaking down common misunderstanding of lymphedema. My name is Teresa Soler, and I am the Research Director at the Dr. Susan Low Foundation for Breast Cancer Research. For those of you who are joining us for the first time, I would like to take this opportunity to introduce you to our organization. Dr. Susan Low Foundation challenges the status quo to end breast cancer through innovative research and improve the lives of people impacted through education and advocacy. We drive collaborative, cutting-edge research with non-traditional partners, shed light on the collateral damage of treatment, and actively seek ways to diminish it, and interpret science to empower breast cancer patients. Many of the projects of the foundation are designed to increase our understanding on human breast, where breast cancer starts in the first place. The foundation is also committed to participation in research that has the potential to positively impact the lives of all people who are at risk for or who have breast cancer. Breast cancer happens in people, so research needs to be done on human beings, and that means men, women, non-binary people, and everyone who gets breast cancer. Our Love Research Army, formerly known as the Army of Women, is committed to encouraging and facilitating breast cancer research in all people, regarding of age, race, gender, sexual identity, with or without breast cancer diagnosis. We are committed of thoughtfully engaging over 380,000 members by providing them with ongoing real-time access to an array of studies. All right, well, that being said, a little bit about the foundation, I'm gonna go ahead and introduce our panelists for today. First of all, we have Sammy Mansfield. Sammy Mansfield is the founder of Cancer Wellness for Life consulting company. Cancer Wellness for Life. This is a consulting company that focuses on developing, implementing, and enhancing oncology wellness and exercise resources targeted towards improved quality of life and outcomes for individuals impacted by cancer. Sammy began her career in 2003 and is one of the world's first certified cancer exercise specialists and wellness experts. Her expertise working with countless cancer survivors worldwide and seeing the power of exercise and wellness strategies in their lives is the driving force behind her persistence and passion. On the other hand, we have Dr. Graf. Stephanie Graf is a medical doctor and accomplished physician who is board certificate in medical oncology, hematology, and internal medicine. Dr. Graf has a strong background in cancer treatment. She is a director of both clinical research at the breast program Sarah Cannon Cancer Institute at HCA Midwest. Dr. Graf is well known for passionately connecting with patients to provide personalized, comprehensive oncology care, advancing breast cancer research and breast cancer prevention. And this said, I'm just going to go ahead and let Dr. Graf start with our presentation. Okay.
Sure. Thank you, Teresa. So first, we're just going to dive in and talk about what breast cancer-associated lymphedema is. So move forward, next slide. So breast cancer-associated lymphedema, and I'm throughout this probably just going to say lymphedema because you're at a Susan Love Foundation webinar, and you can assume I'm talking about it in the context of breast cancer, is when abnormal swelling occurs when the lymph fluid collects in any part of the body. And the possibility is largely after any sort of breast surgery. So mostly it's after significant axillary lymph node dissection. So when numerous lymph nodes are removed from the axilla, AKA your armpit. And we'll talk about the different contexts that can happen. Lymphedema usually develops in the arm or hand, but swelling can also appear in the breast itself. On the chest wall, in your underarm, in your trunk, particularly down like the lateral side, or into your back. And overall, the lifetime risk depends on what type of surgery you had. So for patients who had an axillary lymph node dissection where many lymph nodes are removed, the risk is as high as 10 to 30%. And that big range depends a lot on how we define lymphedema, whether we're defining it based on a patient coming in and saying, look, my arm is swollen, or whether we're defining it based on very nuanced measurements, including even things like water displacement or fat displacement sort of testing that we can do. as opposed to patients who only have a sentinel lymph node biopsy where just one lymph node is removed, where the risk is really very low. Next. So this is just a map of the lymphatic system. Some people haven't seen this before. When we're talking about doing a sentinel lymph node procedure is where at the time of your breast surgery, your breast surgeon would inject, mostly we use blue dye. We also can use a radionucleotide or like a radio labeled dye into the breast, and then see sort of where in the armpit that dye soaks up. And then the surgeon on the day of the surgery is going to see which lymph nodes are the bluest or which lymph nodes are the hottest with the radioactive label. They have a little thing that looks like a Geiger counter that goes beep, 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 beep when they get close to the hot one. And that's how they know which one is the sentinel node. The blue they just see. And they take out whatever's blue or hot with the sentinel node. And those are normally those ones that are in this picture. You guys can't see my cursor. This lowest one down, almost actually at the lateral edge of the breast tissue or the lowest part of the armpit. And then when we're doing an axillary lymph node dissection, the surgeon is removing an anatomic block of tissue where they're going from this margin to this margin and this margin to this margin. And in that, taking out whatever number of lymph nodes exist in that human, in that block of tissue, and they're taking out that lowest level of lymph nodes. They're not getting those upper lymph nodes that you're seeing in this diagram. That does mean, though, that we're not taking out all the lymph nodes. Patients will still, after even an axillary lymph node dissection, have lymph nodes that are in up around the clavicle, down in the lower arm. And then obviously you can see that there's lymph nodes in the center of our body. And as for those of you who have had lymphedema therapy, you will see that patients undergoing lymphedema therapy, one of the primary goals is to help that residual lymph fluid, that sensation of swelling, drain out to the places where those remaining lymph nodes exist so that they can be absorbed back into the system. Next. And I apologize to all the surgeons listening at how badly I just described what they do surgically. Other risk factors. So obviously the number one risk factor for lymphedema is the volume of lymph nodes that are removed. But there's all these other things that we think are related. Radiation. So patients that have axillary radiation, again, particularly radiation to the axilla as opposed to the breast. Taxane-based chemotherapy does increase the risk. So that's medicines like Taxol or paclitaxel, Taxotere, or docetaxel. Increased number of lymph nodes removed, I've mentioned that. Multiple surgeries or poor healing. So patients who have hematomas or seromas do seem to have an increased risk as well. Then there's lifestyle factors. So patients are at an increased risk of breast cancer if they are sedentary, if they don't exercise or move regularly, or if they are also obese. Also patients who have limited range of motion, particularly in their shoulders. Again, no minimal physical activity or no exercise. And also we've seen an increased risk of lymphedema and smoking. Another risk factor not listed here that we saw discussed and presented at the San Antonio Breast Cancer Symposium in 2021 is race. We do see that Black women are at an increased risk of breast cancer. That's true. They are at an increased risk of breast cancer morbidities, but they're at an increased risk of lymphedema. And it's unclear why that is, because it didn't seem to correct just for stage of disease or number of lymph nodes removed. So there is probably other factors contributing to that increased risk of lymphedema. Next. So what does not increase the risk of lymphedema? This is really where our myth busting will start. Routine clinical care. So I know that sort of the urban legend is that if you've had a sentinel node biopsy or breast surgery that you can't and then insert any number of things. And most of those things you've heard are not true. There have been numerous studies shown that routine care does not increase the risk of lymphedema. So you do not need to have your blood pressure measured in your feet. Or blood drawn in your foot. Vaccines also do not need to be avoided. We do typically, the COVID vaccine may be the exception. I do tell patients that have, a unilateral breast cancer history that I would preferentially get the COVID vaccine in their non-breast cancer side, because the COVID vaccine can cause lymph node swelling. And I just think the mental effects of having lymph node swelling as a breast cancer survivor is enough of a burden to carry without worrying about what that might mean in terms of your lymphedema risk. But there's no clear evidence that that the COVID vaccine is in any way unsafe for a breast cancer survivor. So we certainly are encouraging COVID-19 vaccines for our patients. But just routine care, lab draws, blood pressure, cough monitoring, especially if you do not have lymphedema, if all you've had are a sentinel lymph node biopsy, are totally okay. Routine lifestyle, exercise, wearing jewelry, enjoying the hot tub, having a massage, getting on an airplane, doing general gardening activity, housework, playing tennis, playing sports, weightlifting, all okay. Next. So I think I'm going to pass to Sammy, and she's going to talk about risk reduction.
Thanks, Dr. Graff. Before I completely take over, I would love to hear your perspective for the panel about, we're talking about myth busting. Where do we think that some of these myths came from? I mean, do we just sort of decide that we should just not do anything? Or, what do you see as a clinician of why there's so much confusion for our patients as well as our clinical staff?
Yeah, so I think a lot of it is just the history of how we developed breast cancer treatment. So you'll remember that original breast surgery was barbaric. I mean, we started with the Halsted mastectomy, where there was no lumpectomy, there was no sentinel lymph node biopsy. The original breast cancer surgery was full removal of the entire chest wall muscle and all the armpit contents. So everyone got disabling lymphedema because we took it all. Like, we took the lymph nodes in the middle of their chest. It was terrible. Right. And so, and that was also at a time in history when we treated women as fragile creatures who couldn't even know the truth of their diagnosis. And so we certainly couldn't have blood drawn. And so I think that if you look at the sort of historical context of medicine, we started in a place where the risk of lymphedema was very, very bad, and we treated women without the most transparent care. And now we've de-escalated and de-escalated and de-escalated surgery, knowing that lumpectomy with sentinel lymph node biopsy is equally efficacious, clearly much less morbid for breast cancer outcomes, survival, cure, longevity, body image, with no change in with much, much, much lower risk of lymphedema. But that follow-up education piece about what that means for our risk of lymphedema, how to care for our arms, didn't necessarily follow in that sort of urban legend of how we care for a patient after a breast cancer surgery with the same vigor.
Yeah, no, I completely agree. And, Teresa mentioned this in the beginning. I started my career almost 20 years ago as a cancer exercise specialist. And I'm fully transparent that when I started, I was like, we weren't sure about push-ups. We only did bands. My patients and clients were coming in with a don't lift more than 10-pound weight restriction for anything. And if they'd come without a compression garment, then these are people without lymphedema. I would send them away. So I always, think about how much it's things have changed also in my timeline as well. So I thank you for your perspective. I think that's really helpful with some of the clinical challenges. And if we can go to the next slide, we can talk about what can people do to reduce their risk? Because I do think that for our patients and for our clinical team members that are caring for our patients, this is what patients really are looking for. As we mentioned earlier, there are some things around lifestyle that increase risk. Now, not all of those factors, such as changing your activity level after diagnosis, meaning that if you come in and you're unfit, if you start engaging in exercise and activity, you will reduce your risk no matter if you were not exercising before. So we want to talk about now, what are some of these controllable factors? And I think this one seems like such common sense, but it's important to state. We want you to keep the hands and the skin on your, the hand and the skin on your hands and your arms clean and free from infection. I'm not saying you can't get a manicure. This is actually a myth that we didn't have in here. But patients, several years ago, and even the last 5 years, were nervous about getting a manicure. And that is because they were worried about lymphedema. We need to remember that your lymphatic system is responsible and is a big part of your immune system, and your skin is that protective layer. So keeping your skin clean and free from infection, trim your cuticles, keep your skin soft. If you get a cut, put some antibiotic ointment on it, cover your cuts, etc. That just reduces your risk of lymphedema, because that infection could exacerbate, the lymphatic system, and lymphedema can be a byproduct. Covering your hands and arms while doing yard work. This is simply because if you're like me, I'm the one that's going to have a big scratch on my arm. If I'm in the kitchen, I tend to kind of cut my hands a lot if I'm doing a lot of food prep. So sometimes I tell people, if that's you, if you're kind of a little bit more clumsy like Sammy, wearing a glove when you're in the kitchen, working in your yard with gloves, it seems small, but is definitely significant. Also, wearing sunscreen daily on your arms, your chest, is definitely important because we want to keep our skin protected, but we know that the skin itself can become sunburned and damaged, and a severe sunburn could potentially lead to a risk of lymphedema, increased risk. So it's just really an important and simple way that you can take care of your skin. The other thing that we want to talk about is lifestyle. So again, early on in my career, we really didn't understand the role of lifestyle and some of the small, simple things that we can all do to maintain a healthy lifestyle to reduce our risk. Because as an example, remember that anatomy picture that we showed and all of those lymph nodes that are through the neck, the chest, the arms, and the torso. The more you have good open posture, the more that your lymphatic fluid can move. So for women and men who have had mastectomies and radiation and other types of maybe surgeries, rotator cuff shoulder surgery, etc., having tight, weak muscles in these regions can take that posture forward the same way that we are sitting here, maybe on a computer. Take a moment and adjust your posture, stretch those shoulders back, and that also, thinking small, but helps open up your tissues and helps that lymphatic fluid move. Maintaining your weight. Obesity is one of the known risk factors for lymphedema. And we also know that many of our breast cancer survivors and thrivers, whatever terminology works for you, but these are the people that are really frustrated by weight changes due to maybe hormone changes from treatments, treatment side effects. So maintaining your weight is certainly important. And having an exercise program is one key piece of maintaining a healthy lifestyle. And because people will ask, what should I do? We've got a few sample exercises that you can try here in a moment. Having a regular program is going to be key. And recent research, really only about 12 years ago, showed that regular exercise program consistency really even reduced your risk of lymphedema, as well as helped manage lymphedema for people that were diagnosed. And then lastly, and this is just a general healthy lifestyle, keeping your body as healthy as possible, having a minimally processed diet, consuming 5+ servings of fruits and vegetables. That's important for nutrients. It's also important for things like hydration and just having a healthy immune system, having adequate protein intake. I think that can be difficult for a lot of us to get in our protein intake. These are all things that we know keep our bodies healthy and generally reduce our risk of lymphedema. Next slide, please. So these are the exercises that I want to demonstrate. And before we do that, I have actually pre-recruited Dr. Graff to assist with these. And I know Dr. Graff really well. And my guess is she's wearing a dress or a skirt, as I normally am. And so I tell people you don't have to be dressed to exercise. And so I recruited her to participate in that today. But before we do this, I want to talk about what are the exercise recommendations in general, because I do think this is important. We know that anyone impacted by cancer, any even adult in the US, has the same physical activity and exercise recommendations. Physical activity, stay as active as you can and reduce inactivity, but generally exercise, planned physical movement. Your goal is to get at least 150 minutes of moderate activity per week, including 2 days of strengthening. And we've seen a lot of evidence that this strengthening activity, this muscle building activity, is really vital for lymphedema because those muscles act as a pump to help move that lymphatic fluid. They assist with range of motion, they assist with your energy, and they really also assist with your weight management. So taking a look at this sort of general number, it breaks down to doing about 30 minutes if you want to exercise 5 times a week, or 22 minutes-ish if you want to do something every day. But these are goals and guidelines that you can strive to. Even starting with just a few minutes per day really makes a big difference. So I want to give you a sample of something you can do at home, because guess what? You can exercise from anywhere. So we're going to try these exercises, which are also included on the piece that you'll be able to utilize after this webinar is over. So Dr. Graff, are you ready? So we're going to do a few things. I'm going to shift my my camera so you can see me. So we're going to start with a shoulder press. You ready?
Yeah, I'm in a dress, so it's going to be ridiculous.
No, it's all good. It's all good. So that's what I'm saying. Anyone can exercise in a dress, but you're going to sit first and everybody can try this.
Oh,
Teresa,
good.
I'm watching you too. Yep, sit
You want
first.
me sitting?
Yep, we're going to do the
Okay.
shoulder press first. So we're going to just do these main full shoulder presses. And I want you guys to try these. Pinch your shoulder blades together. Try to press your arms as straight up as possible. Add a nice big breath. Inhale down, exhale, press up. And as you're doing this, guess what? We're building muscle, we're building range of motion, we're building flexibility and strength. Now, here we go. We're going to actually keep those arms down and let's go ahead and take a squat or a sit to stand. So let's go ahead and stand up and then sit back down. We're going to do this just a couple of times and up. Yep, and back down. Now let's add those two together. So let's squat and press and back down.
You guys thought you were coming to a webinar and now Sammy's doing exercise.
I cannot do a webinar without adding at least a minute of exercise or everybody would be sad. Let's just do 2 more, but yes. And I hope you're doing these with me today. Yep, go ahead, Dr. Graff.
And then Sammy, as people get comfortable with this exercise, you would have them add hand weights, right?
Yes, correct. Absolutely. Let's go ahead and move over to the elevated push-up. I'm going to demonstrate that one. Yep, great question. So if you can achieve full range of motion without pain, that's when you want to start adding load or resistance. Grab a set of soup cans. That's just 1 pound and work against that resistance. So let's demonstrate one of my other favorite movements, which is an elevated push-up. I'm going to do this on a desk today. So I'm putting my arms just right outside, shoulder width apart. I'm going to walk my feet back and I'm going to bring my chest down and then just press up. So this is a great exercise because people ask me all the time, can I do push-ups? And there's no reason with risk of lymphedema, or even if you have lymphedema, you can't. But I like this exercise because it also works the core, it works the booty. We all like that. And it's something you can do if you're waiting for your coffee to, be made, or you're looking at something like in the microwave, etc. And then the last exercise, working the core, is same position, but I'm going to show you one level different. I'm going to come down to my elbows so you guys can do this in your meeting. And now I'm going to lift my heels behind me, if you can slightly see that. So I'm working all of those muscles in my core, chest, back, because we sit so much during the day. And those are really simple things that we can do to build up that strength and flexibility. And that simple routine can help with your activity and therefore reducing your risk of lymphedema. Dr. Graff, great job. All right, we'll go back to the slide presentation. Thank you. So these are the exercises that you can see. Let's go ahead and move. Let me actually, before we move, let me talk about repetitions because it's written here and I want to bring it up. If you're a beginner, you haven't been exercising, you're just coming out of surgery, you're not really sure what to do from resistance, I would like you to start with around 5 to 8 repetitions and just do 2 sets. We want to make sure when we're exercising that we call it slow and low. So we want to start with slow, low repetitions, allow our lymphatic system as well as our muscles and joints to adjust, and then start adding from there. That's the most appropriate way to exercise, especially if you're at risk of lymphedema. If you're an intermediate, person, as far as you've been exercising, you've done a few things, but you aren't sure where to start, I would recommend moving up to around 10 to 12 repetitions, build a little bit more muscle and endurance, and really shoot for that 3 sets. If you did this routine just twice a week, you're going to be right at that muscle strengthening activity recommendation just from this simple home-based plan. So I hope you try it and let us know how it goes. Next slide, please. So again, we're going to continuing on a little bit on the myth busting. We've got a couple of more things that I think are going to be really beneficial in lifestyle. Next slide. So this is really a summary of a lot of the questions that we get in a lot of, with patients, whether they're in clinical settings, they're in treatment, or even many years beyond. So I'm going to start this, and then Dr. Graf, I've got a couple of things that I'd like you to contribute to as well, please. But I think it's most important to understand that we are targeting this slide for people that are at risk. We'll talk in a moment about when you are diagnosed, but this is the at-risk group. So the biggest question
how are you defining at risk here?
Thank you, absolutely. So at risk would be someone who has had the surgical procedure, might have had an axillary or even a sentinel node, and maybe had one or more of those other clinical risk factors, such as radiation or another, the Taxol-based chemotherapies, et cetera. If you've had on that earlier slide, that bucket, as well as the lifestyle bucket, based on your surgery, you are in an at-risk population, okay? Anything to add on that one, Dr. Graf? Does that fit? Okay. So if you are this person, the question people ask all of the time is, I've had surgery and I'm getting ready to take a trip. Do I need a compression garment? Do I need a compression garment to fly, resume my tennis regimen, whatever that is? If you are at risk, there is no evidence that states that wearing a compression garment during those activities is beneficial to reduce your risk of lymphedema. And for many women, they report discomfort. They don't really enjoy wearing it. And so it is quite a bit of a stressor for a lot of our patients. And I'm very confident to say years ago, we didn't know, so we gave it to everybody. But now we know that it does not reduce your risk, and therefore it is not necessary as a preventative. And same thing, what about lifting my arm? Once you're cleared by your surgeon, we want you to start moving your arm. And in fact, the evidence states that early range of motion post-surgery is key. So within the surgical, your surgeon will likely give you recommendations, even as you go through things like reconstruction or other longer term surgeries, not just your first surgery. You want to use that arm and not just skip using it and tucking it in, because it can lead to other problems, lymphedema, as well as other joint challenges. Same thing about exercising with weights. Start low, go slow, but weights are very beneficial. I get asked this all the time. I don't know if other people, have heard this. People say, can I do a plank or a downward facing dog in yoga? And I go back to a basic exercise recommendation. If you are weak in upper body, a downward facing dog may be challenging in yoga. And so although it wouldn't increase your risk of lymphedema, it's probably not the place to start if you're a new exerciser, just because it's going to be very difficult to maintain that good posture. And then avoiding carrying a purse or a backpack. There's no evidence that you shouldn't. However, we do tell people for comfort and just a good recovery post-surgical that to avoid carrying the purse if they have a unilateral surgery, to put their purse on the other side seems to be just smarter and just allows the skin and the tissues to heal, but is not necessarily going to increase your risk of lymphedema. Dr. Graf, anything to add when you're speaking to your patients?
Yeah, there's a few questions in the chat about the difference between somebody who's at risk versus has lymphedema, and obviously that's different. If you have lymphedema, compression garments are the therapy for that, and so you're going to need to wear your garment as a part of your therapy. And I have patients with lymphedema that wear compression garments in a million different ways. I have them who wear it all the time. I have them who wear it intermittently. I have patients with compression devices that they use nightly. So there's a million different solutions. And in that case, you're on a treatment that's specifically prescribed to you for your diagnosis. And that's different than not having lymphedema, in which case you're trying to prevent a disease. And so that's different. Another question in the chat, Sammy, I turfed for you, which is it safe to do floor planks?
I just answered that one. It's a great one. And Yep, nope, that's okay. I know there's a lot of, thank you for the questions. Absolutely. From a lymphedema perspective, absolutely. There is no movement, tennis, golf, any of those that we know actually exacerbates your risk of lymphedema, if it's the right fitness level for you, is my caveat. So if you're brand new, you're a beginner, I wouldn't necessarily recommend starting with a floor plank, but if you've been planking, then you can do a floor plank. So I think that should be really important to note. And I think Dr. Graf mentioned this earlier, we kind of have babied a lot of our patients and we're like, ooh, just do gentle stuff. And honestly, we want you to be at the right fitness level because it'll keep you strong, it'll keep your weight in check. Those kinds of things are really important. So think about this as not a lymphedema concern, but a fitness question of your level. And then that should fit also in the lymphedema sort of question for a lot of you that are kind of looking at different exercises. If you haven't been doing a lot of yoga, I wouldn't start with a yoga that's doing a lot of postures where you might be using a lot of weight on your arms and shoulders because you just may be weak. And so I think that it's appropriate just to think about the right level for you. Any other specific things that I might be missing in this one? I do think it's really important to talk about, there's one thing in here about the safe movements and exercise if you do have lymphedema, and we're going to come to that here in a moment. But I do think it's really important to reiterate that these are the pieces that if you're at risk, that you don't need to be as concerned about. But I want to be totally transparent and very honest. You may still be hearing these if you are currently being treated, because I see something regularly, like online, people ask me about, and they're showing me something that was updated just a couple of years ago that is not this up to date, but this is the most current evidence here in 2022. So that's why I'm really excited about, the Susan Love Foundation doing this piece, because we feel it's very, very important. Okay, let's go ahead and move to the next slide. So, perfect. So when should I be concerned? This is really important. And, we talked a little bit about vaccinations, but we really want to be clear that if you have concern, your concerns are valid. And it's really important that if you are concerned about these symptoms, and it doesn't have to be a check all, but one of these signs or symptoms, that you should contact your surgeon and oncologist and request to see a certified lymphedema therapist if you have not maybe saw one pre-surgery. Some people do, some people don't. Things like the swelling and heaviness and achiness that doesn't go away, signs of infection and persistent swelling, that unusual tightness. So remember earlier we talked about wearing a watch or wearing jewelry doesn't increase your risk, but can be a great benchmark when you'll notice your tightness in your hands. All of a sudden you're like, wow, my rings don't fit the same. My cuffs of my shirt don't fit the same. My sleeves feel really tight. And I think that's really important to note, that could be an early sign of lymphedema, and you should contact your surgeon or your oncologist or wherever you're being treated so that you can have that evaluated. Dr. Graf, anything to add here in your patient communication?
Yeah, I would just say that anytime that you're concerned that you have a new or changing symptom in your arm, you should reach out and even sort of explicitly say, whether you're calling or using your portal, that you're worried that you have new onset lymphedema, because sometimes that can save you a trip to see the doctor. Sometimes if a patient says that to me, we just arrange for them to sort of come directly into the lymphedema clinic rather than into the medical oncology clinic. Obviously in the breast cancer population, another concern that we think about is blood clots, which can also cause unilateral extremity swelling, particularly for patients on tamoxifen or who still have a portacath in place. So that would be the other concern if you have acute onset new swelling somewhere, that we would want to make sure that we weren't missing. So it depends a little bit on the story and the history.
Can you also provide the latest perspective on what do we know with like early intervention And like there's always been this sort of myth of, well, if you get lymphedema once, and there's a question that I would like to actually loop this back to, if you get lymphedema, you're never free from lymphedema. However, we've seen that early lymphedema can be treated, and the patient will have no other, sign or symptom. So can you address what you tell people with early lymphedema? And then in addition, we had a question about someone who had one incident of swelling 9 years ago and wanted to know about wearing a sleeve while flying. What do you tell your patients kind of as we go through this trajectory?
Again, there are a lot of persistent myths about lymphedema. And so what I do is try my best to say, listen, like in the breast surgical societies, in the plastic surgery societies, in the physical therapy societies, in the lymphedema societies, publication after publication after publication has shown that these things do not increase the risk. And I do not know why that does not filter down to the level of the medical assistant who is rooming my patients. But Sammy and I have worked together clinically in the past, and so help me God, my own medical assistant, I've caught checking blood pressure in people's legs, and I thought my head would explode. Because those myths persist, and then you have to try to, it's just, you feel like you're recreating the wheel day after day. I think we just have to continue to talk about it. I think that for everybody listening, you're a unique individual patient, and you should go to your doctor and say, I have a lot of questions about what my risk of lymphedema is. In terms of the longitudinal nature of lymphedema, the other part of lymphedema that's complicated is our ability to diagnose lymphedema early has gotten a whole lot better. And our ability to diagnose lymphedema at all has gotten a lot more sophisticated. So, when we think about the 5 or 10 or 20-year follow-up of what happens to a patient diagnosed with lymphedema, somebody diagnosed with lymphedema 10 years ago was probably somebody showing up saying, look at my swollen elephant arm. And so that lymphedema versus somebody who is diagnosed today, who often had serial measurements at 9 points in their arm before diagnosis, a month after surgery, 3 months after surgery, and their lymphedema therapists, they're like certified, licensed, trained lymphedema therapist says, well, 2 of the measurements are 0.5 millimeter bigger. So you meet the criteria as having mild lymphedema, and is going to check that box and recommend therapy so that it doesn't progress, because the best treatment of lymphedema is early intervention. That's a very different person with lymphedema. And we can all take a step back and acknowledge that. And so, will that person have persistent lifelong lymphedema? Will that person need to wear a sleeve when they fly for the rest of their life? Will that person, get a giant elephant arm if they check their blood pressure in that arm? Probably not. I don't have that data. I can give you the data that if you've never been diagnosed with lymphedema, that the data doesn't support that you're at risk from routine medical care. Most breast cancer survivors are lucky in that they have a diagnosis of breast cancer that's unilateral. So even if they have been diagnosed with breast cancer, they have another side that they can safely use for lab draws and blood pressure cuff measurements and that sort of things. Obviously, some people have bilateral diagnosis, and that makes it more complicated. But I think that in 2022, when our ability to diagnose early and diagnose sophisticatedly lymphedema is what it is, our ability to say the longitudinal history of lymphedema is just different. And that's when you look at meta-analysis, which is where we pool data. One of the big criticisms about meta-analysis on lymphedema studies is that the definitions don't match. So it's very hard to look at those studies over time and compare them because they're not even defining lymphedema the same.
Yeah.
I said a lot of things, and hopefully that answers some of the questions you asked me.
No, I think I think you're bringing up a really good point. Just like probably if you're coming to this webinar as a patient, not every doctor is the same, right? And some physicians have a different perspective of how they, approach your cancer diagnosis. And maybe in their thoughts around lymphedema, they might be more progressive or more conservative for various reasons. We find that also in lymphedema therapists. And so sometimes, there are certifications, there are credentials, but we have seen lymphedema therapists that as soon as there's something they're concerned about, they're going to wrap your arm up in this package of, compression and have you wear it 24 hours a day for the next 7 days. And patients are like, do I have to? And, some of the evidence is that has been successful for some patients, but it isn't always successful for all patients, right? And so the thing that we want to think about here is there is a lot of individuality here. And even if you are at a higher risk, do the things that you can do, engage in the lifestyle and behavioral changes that you can control, because then you're reducing not only your risk of lymphedema, but you're reducing your risk of other chronic diseases, you're improving how you live your quality of life overall. So I think sometimes we get kind of narrow and we're worried that one person said one thing or whatever that may be. But a lot of these are just very important lifestyle and behavioral habits that are beneficial for you after breast cancer. And I think that's really important to reiterate. But I do think this is certainly an important topic, and obviously based on the questions, there's a lot of questions overall. But let's go ahead and move to, we've got a couple of more slides I want to make sure we get to before we do full Q&A. So this has been asked a couple of times. What happens if you're diagnosed with lymphedema? Now, we say clinically diagnosed, you've heard, you'll continue to hear, we'll probably say it again. This is still a little individual of how you're diagnosed. There's definitely different modalities. However, if you are diagnosed with lymphedema, your plan will likely change. And I would encourage you, especially when it comes to exercise and some of those activities, to work with your lymphedema therapist on, are you doing the right load or volume? Do you have the right range of motion? Sometimes that is really problematic in this population. We need to adjust range of motion, take resistance off, those kinds of things. But you'll get a plan that'll include that lymphatic massage, as we talked about earlier, to move that lymph fluid to other areas of the body, focusing on range of motion. You might get a compression sleeve or wrapping at this point if it's appropriate for you. If you get a compression sleeve and you're recommended to wear it when you exercise, there's a reason. I can't imagine it's comfortable. I've practiced wearing it, but not worn it. But there are benefits to doing that. Especially if you are, just resuming or getting into an exercise program. You should get an individual exercise program from your lymphedema therapist that's going to look a little different than what you might see in the gym. This is all part of the treatment plan. So you can see a lot of these go into the things that we talked about for prevention. We're just now shifting the treatment plan to be a little bit more personal. Go ahead and go to the next slide. So I think that the most important thing, this questions also came up, and I would like to actually punch this, not mean, but back to Dr. Graf. Can you reiterate, are we missing anything as far as the routine clinical care? What do you tell your patients? What do we need to reiterate with the COVID vaccine or other vaccines? Can you provide like the clinical care summary for us?
Yeah, I think for a patient with a diagnosis of lymphedema, avoiding the COVID vaccine in your extremity with lymphedema is very important. Obviously the COVID vaccine is approved for administration in the arm. But I have had a patient with bilateral lymphedema tell me that her pharmacist gave it to her in her thigh. I don't know. That's not how it's labeled from regulators. So I don't know the success of others being able to get it administered that way. Other vaccines, it's very reasonable to likely give them in another extremity. the COVID vaccine is sort of the exception to the rule about vaccines causing swelling. Most vaccines don't cause much of a local reaction like the COVID-19 vaccine does. So that's probably a unique situation. For patients with a diagnosis of lymphedema, I think the body of evidence still suggests that exercise is safe for them. You know, I think you're saying all the right things. You know, if obesity is a risk factor for lymphedema, obviously staying closer to your ideal body weight is going to be helpful. If dehydration is a risk factor for fluid retention, staying hydrated is going to help you circulate your body fluids more in a more healthful way. Protein is what keeps our fluids inside our blood vessels. Having a high protein intake is going to help our fluids stay inside of our blood vessels. And so all of these tips are things that just help you maintain in the most healthy way possible. I think those are, I guess, my pearls.
Nope, I think that's really important. I know that, you know, that definitely gets asked a lot. And I think you should, you know, ask the question again. You know, there's no reason you can't bring this back up with your physician or even lymphedema therapist. If you have had a diagnosis of lymphedema, it's likely you have been treated by a lymphedema therapist. So again, if there's something personal, because we are doing a general webinar, really want you to talk to the people closest to you that are treating you, taking this information and having a conversation that is personal to you as well. Next slide. So I want to talk a little bit about this because there are some definitely emerging studies about self-assessment. We've actually seen a lot of studies. There was a really big one done in Canada not that long ago that looked at how teaching patients how to self-assess in this way that we'll demonstrate with the monthly measurements actually reduced anxiety and fear around lymphedema. And so it's a great piece for partnership with the clinician and the patient. So you have something very tangible and very factual when you're like, I don't know, is my arm swollen? I'm not really sure. So there's a couple of ways to do this. I'm going to go through the clinical piece, then I'm going to give you what I kind of call the SAMI shortcuts. So these monthly assessments, doing something monthly as far as regular assessments, both sides, even if you've only had a unilateral breast cancer, are important. I would recommend set a timer or schedule on your calendar. First of the month, whatever, 15th of the month, you do these assessments and you document in a really simplistic manner what you see. So you want to look at your hands if you have any pockets of swelling between your fingers. You want to look at your arms in the mirror, and you want to look at your elbows. And we want to look at both sides and have some comparisons. It doesn't take but a minute. You can do it, you know, in the morning, even before you brush your teeth. Now, as we mentioned, a lymphedema therapist will likely measure the circumference of your arm, and they have a process. It might be every 7 centimeters or however they do it. There's a lot of spots that are measured. There's a way to do this at home. So if you look at this, you can do your upper arm left and right, finding a mark, you know, and you can see a really technical term. I like to do it really simple. I'll say, here's my shoulder blade. I'll go, you know, so many inches, 5 inches below my shoulder blade around my arm. And I can either write a measurement with a tape measure or take a piece of rope or ribbon or some sort of simple thing that you have around your house and just mark it. Make sure you're doing both sides. You want to do upper arm, forearm, your wrist, and your hand. And again, we want to think about both sides because that if you have swelling on one side, right, that might be obviously your breast cancer side, but we know that body composition and weight changes are kind of normal in this particular population. So if you start to see a measure go up on your surgical side, it's important to know if it's going up on your non-surgical side if you're a unilateral breast cancer patient, because it might be weight gain or body composition changes. So this is a really simple thing that you can do and take just this little guide and do it again every single month. You don't have to do it every month, but it would be ideal to do every month, especially as we go through seasons. And you'd be able to identify that swelling fairly quickly and be able to have factual information to take also to your clinician. So this is a great tool and one of the reasons we wanted to make sure to share this today. Dr. Graf, anything to add here? I know we talked a little bit about this sort of protocol as well. Any thoughts from a clinician?
Nope, you're doing great.
So this is all of the slides that we have for you guys today. I know we have a few more questions. Teresa, I'm going to let you lead our Q&A. I know we've been trying to get through a few of these.
We tried to answer some in the chat, but they were fast and furious. So I think we have like a million that you were circulating.
Well, I know we have 10 minutes for questions, so I'm just going to go ahead and read a couple I think that have been unanswered. So Ruth is asking, one of the things that I am concerned is the time frame to progression. So when you say early intervention, what does that really mean? When the arm is how much larger than the other? Time frame for surgery?
Yeah, for me, okay, so that's a great question, Ruth, because that's another example of definitions are really minced in the medical literature. So I think that for me, early intervention just means that as you notice the symptoms, you get help for it soon. You don't wait for your 6-month or 1-year follow-up appointment to be like, oh yeah, my arm's been swelling over the last 6 months. I didn't tell anybody. So what I would say, one of my nurses used to jokingly call it the Dr. Graf 2-week rule, which is that we're all allowed to be weird for 2 weeks, right? Like if you fall down your stairs, your back's going to hurt, but it should get better. If we eat too much salt, our whole body's going to be puffy, because let's face it, none of us are 16 anymore and we can't get away with that. So like if you notice some swelling, it's okay. We're all going to swell sometimes. I've not had breast surgery and sometimes I can't get my wedding rings off. But that should go away. And if it doesn't, you should be calling your surgeon or your medical oncologist or your radiation oncologist and saying, hey, I'm having some new swelling. Should I have it looked at? So that if you are starting to develop the signs or symptoms of early lymphedema, you have therapy when it's 1 or 2 millimeters of swelling, not the quote unquote elephant arm that we all think of when we think of lymphedema. So to me, early intervention is more about time from onset of symptoms to help than time relative to your diagnosis or your surgery. Sammy?
No, I absolutely agree. You know, we did have a couple of questions that came through the chat talking about that post-surgical swelling and a little bit of concerns. Should I be worried? I'm, 2, et cetera, weeks out. And, it is important to think that there is to realize there is going to be post-surgical swelling that is not lymphedema. It's just post-surgical swelling as your body goes through that healing process. But if you are concerned, I think you should speak to your physician who you probably are following with, just to make sure those questions are answered. I think at that point, we're more concerned about infection. And is the infection going to slow down your recovery and again, put you at a higher risk in another capacity? So that would be my definite recommendation as well. Don't discount it, but try not to freak out.
Yeah, and what I'll add to that is that, in the post-operative setting, what I would say is that regardless of whether you had a lumpectomy or mastectomy or a sentinel node or an axillary lymph node dissection, I would say that surgical recovery is 2 to 6 weeks. But over that time, it should be gradually getting better, not gradually getting worse. So if your swelling in your armpit is swinging up instead of swinging down, it warrants a phone call or a check. And unfortunately, you can get seromas, which are pockets of fluid, or hematomas, pockets of blood after surgery. Those sometimes do need to be drained. And as we said earlier, developing those does then increase your risk of developing lymphedema in the future. So if you have a pocket of fluid that's developing in that postoperative window, your surgeon might drain it. And then a reasonable question is, because I developed this seroma, should I be talking to a lymphedema therapist? Should I be considering going back into the compression garment I was in after surgery? Or if you weren't given a compression garment after surgery, should you be in a compression garment now that you've developed that seroma to prevent it from reaccumulating or to help you heal and recover after surgery? Radiation is maybe the opposite scenario where it gets worse before it gets better. I like to joke with my radiation oncologist that they give patients these diplomas on their last day of radiation and then send them home with the celebration that they're done. And then actually the worst is normally the week after,
Yeah.
which is maybe mean. And so sometimes your redness and skin tightness and irritation is actually worse at the very end of radiation, but you should be seeing your radiation oncologist weekly as you go through therapy and talking about those symptoms. And if at the end it's particularly bad and your radiation oncologist plan is to see you in 6 weeks, you can say, hey, I'm worried about this tightness, redness, pain. Can we touch base sooner just to make sure that it's recovering? Or what would be your trigger for me to come back? Or, I mean, ask the questions that you need to ask to be comfortable with the fact that it gets worse before it gets better in the setting of post-surgical radiation.
And I think, you know, when we talk about exercise and this sort of window of recovery, the more recent research in kind of 2020 really looked at that early range of or early exercise and range of motion. So thinking range of motion, not load, actually would help speed up recovery. So a lot of times, you know, range of motion exercises are recommended right after surgery and really kick off a week after even a mastectomy, thinking about things like checking your posture, squeezing your shoulder blades. And although you might not think that's really not an exercise, it really is an important exercise to, again, open, stimulate, start to improve range of motion. So sometimes the walk up the wall thing has been really common. That's still a good one. I personally tell people walk up the wall forward, start to walk up the wall sideways. I mean, whatever that kind of works for you, but start going through range of motion as early as you can, you know, post-surgical, and that's typically a week or two. Often 2 is like the maximum, but we do see exercises initiated at week 1, and we've shown that it has reduced the risk of lymphedema overall. So I think it's important for people to know that if you promote your body to heal, you're assisting the process, and that is a really important process to just long-term well-being, even beyond lymphedema. And I think that's extra important.
Thank you, Sammy. We have 2 more minutes. If you can quickly say something about any resources for adapted yoga postures that people can check online, maybe.
Yep. So my favorite YouTube channel is a free, has a ton of YouTube called Yoga with Adriene. And I would suggest, I like hers because it's a full class you can follow along and you don't have to think. And I kind of like that as well. Here would be my suggestion for what you're looking for. Look for something that includes things like breathing, stretching, flexibility, core. Stay away from the strength building ones in the beginning because you won't be loading your arm as much. That's a great free resource that you can find. Do Yoga with Me is another great resource. Again, targeting those types and modalities of yoga can be a great place to start.
That's great. And I think one last question that I would love to answer is any resources to find experts in lymphedema across the country for those who are not in California?
Yeah, well, neither Sammy or I are in California. You should be able to search for certified lymphedema therapists. There is a lymphaticnetwork.org that has that you can use to search for certified lymphedema therapists. And most cancer centers will have a certified lymphedema therapist as well. And you can ask your cancer center if the physical therapists are certified in lymphedema. And you can also ask questions about how recent their training and certification is, because I've also seen some discrepancies in the knowledge bases of lymphedema therapists. So feel free to make sure that you're getting up-to-date information from your lymphedema therapist as well.
Definitely.
Fantastic. Well, that was great. Thank you so much. Unfortunately, we're out of time today. I would like to thank Dr. Graf and Sammy Mansfield for their participation. If you have any questions that were not answered today, or would like to get in touch with the Foundation about the Love Research Army or any of our research initiatives, please email info@drsusanloveresearch.org. Today's webinar has been recorded and will soon be posted to our website, which is linked in the chat box for your convenience. And I also encourage you to visit our website if you're interested in learning more about the foundation or maybe making a donation in support of our research. And again, thank you to all our panelists. Thank you to everyone who joined us today. And I hope you all stay safe and healthy and have a good rest of the day.